Aloha, good morning everyone. Mahalo and thank you for being here for AlohaCare's internal webinar series, Enlivening a Culture of Health, in today's 6th episode. We're going to begin in just a couple minutes. As we welcome our teammates, please again familiarize yourself with the Zoom webinar features. Please also join the webinar live without logging into your Citrix or VPN. This will optimize your video and your audio throughout the session. Our session today will also have a presentation. So if you can see your screen, our guests will be sharing a lot of important information, contact information, and more ideas around the programs and services that they provide. Looking at this slide here, we want to reorient you to 2 areas, the question and answer box. At any time, if you have any questions, go ahead and just put them there. You can ask them anonymously of our panel. It's easier to grab the questions from there than in the chat. In the chat feature, Chelsea is putting lots of information for you in links, including the webinar info for you to log out of Citrix and VPN now, and you can log back in without being on the VPN to help your video and your audio. And lastly, as a reminder, we're recording this session for our staff who might be unable to attend with us live today, and if any of you want to rewatch this later. We're not recording you or any of your audio. We're just recording what's happening here in the box on this session. And just as a reminder, this webinar is a safe, anti-racist virtual space led by the values of Hawaii. With those brief tips to orient you, let me warmly welcome everyone to the AlohaCare Enlivening a Culture of Health webinar series. Our 6th and final episode is going to focus on the importance of community safety by deepening our understanding of trauma and violence and increasing healthy survivorship in Hawaii. This episode was scheduled around Father's Day. So we want to start by also honoring all of the dads, grandpas, godfathers, stepfathers, papas, and uncles joining us live. It's also National Safety Month. Our guests at the Domestic Violence Action Center have launched a social media campaign called Rad Dads. So all of our Rad Dads that are joining us, we welcome you here. As Hawaii transitions out of COVID response into COVID recovery, we know it's time for us to better understand the social determinants of health needs of our members and outline a strategy to address those opportunities across the work we do. Community and cultural strengthening is one of the core domains in AlohaCare's new SDOH work plan and strategy we have adopted. In our work with Divac during the pandemic, we know that safe communities are at the core of healthy families. As customary in Hawaii, we start this webinar today by acknowledging the land and natural environment as the preeminent source of Mauliola, life, and our whole health here in Hawaii. All across Hawaii remain these ancient sites which we call Puunua. Puunua were dedicated sacred places that people could go to for respite, sanctuary, and healing. In these Puunua, no one could be harmed physically, mentally, emotionally, sexually, verbally, or spiritually. Such pu'uhonua, like the one pictured here in Hilo called Moku'ola, were designed and protected to provide refuge as a community within a community. Our oral histories and missionary documents have been preserved to let us know that prior to the time of Christian contact, Native Hawaiians did not practice violence within their relationships and families. In fact, to strike a child, endanger a pregnant woman, or abuse an elder in Native Hawaiian society was so taboo and restricted that Kanaka Maoli beliefs held that by committing this heva, this sin, would result in a curse that would bring about the demise of the offender's soul and their premature death. And so I pause here as today's moderator. It's my duty to provide this trigger warning. This webinar will contain material, discussion, and examples about domestic violence, intimate partner violence, and may be difficult for people with their own history of abuse, neglect, or trauma. Please be mindful of your own self-care during your health matters to us during this session. If any of the material is troubling for you or someone who may be around you and listening today, please feel free to turn off the volume or step away at any time. A pu'uhonua can be a place that we go to in Hawaii. It's also a mental state of our wellness and our own care. So today I invite us to create a contemporary pu'uhonua where difficult content educates us to stand with survivors who need our support. It's my pleasure to introduce our esteemed guests. As I briefly share their bios, I'll start off with our first poll, which you'll see pop up on the screen. You should see it now, asking around COVID-19 reporting. And go ahead and just pick the answer that you feel like most aligns with what you have learned throughout the pandemic. And also help me by welcoming our panelists. Christina Arias, the Vice President of Survivor Advocacy Services. Christina oversees programs and specific services serving the needs of Hawaii's diverse cultures and languages by leading Kofa, Korean, Japanese, Hawaiian, Pacifica programs for the Divac clients. Welcome, Christina. Kaylee E. Byers is an outreach educator and advocate for their TAP 808 program that focuses on teen education and healthy relationships among young people. Lydia Pavon is the housing manager at Hale Maluhia, who helps eliminate housing barriers for domestic violence survivors. As folks finish up their polling here, it looks like we have a lot of folks who quickly were already able to vote. I'm going to introduce our first speaker. Nancy Creedman is the Chief Executive Officer and founder of the Domestic Violence Action Center. Auntie Nancy, as I will call her, is a pillar of strength and inspiration in our community and across the US. With 4 decades of activism, you cannot speak about domestic violence in Hawaii without Auntie Nancy and hearing her stories and examples and motivation about peace and love. I'm not going to list off all of Auntie Nancy's awards. Instead, as DVAC reflects on their 30th anniversary serving survivors in Hawaii, I just want to introduce Auntie Nancy Creedman as a pearl of hope in a sea of change. Oh. Mahalo nui for all of you for taking your time to be with us today in our 6th and final episode. Auntie Nancy, I'm going to turn it over to you now. You can turn on your audio, and I will help advance your slides as you provide the overview presentation to our team tuning in today.
Thank you. It's a great pleasure to be with you. It is so important for us to have the opportunity to speak to our community. We never decline an invitation to join our community and help them understand the complexity and the cost and the impact and the truths that we see here at the Domestic Violence Action Center every day, all day long, every year since our founding in 1990. So it's very important for us to keep the conversation alive about domestic violence. I just want to start by sharing what our vision is. It's a big vision. It's a goal we work for every day for all women, children, and men in our community to be safe and free from harm in their homes and in their relationships, with the freedom to make positive choices about their lives and the opportunity for stability and self-sufficiency. You can only imagine how difficult and challenging and overwhelming this can be when you are experiencing the trauma and terror of abuse by a partner. Our core principle, as Kealoha mentioned, is that safe families are at the core of a healthy community. Survivors take their experiences with them out into the community as they interact and live beside all of us. And so we have to be mindful that the story that they are living is touching us when we are in each other's presence. I am going to move on, Kealoha, to my next slide after that one. I just introduced everyone to our vision. I wanted to make sure that we're all working from the same definition of domestic violence. It is not a well understood problem still after 30 years of Domestic Violence Action Center's work to raise public awareness and community awareness about the problem of domestic violence, which could be one of our greatest challenges, the fact that this is not well understood. It's a pattern of behavior. It's not an isolated incident. It's not a one-time event. It's a pattern of coercion and control that one person will use over the other to maintain power. There are a variety of different kinds of tactics that a person will use. Often when we use the phrase domestic violence, the community thinks of physical assaults or bruises or broken bones or injuries. And that is just one way that abuser resorts to controlling their partner. There are many, many other ways that are much more subtle and much more difficult to see. Some examples that I've included in our list here just are threats, economic deprivation, which goes to the first poll question, psychological abuse, isolation, which means that a survivor whose partner is controlling her communication with others, her whereabouts, her decision-making, her contact with family and friends and coworkers, intimidation. Maybe a person hasn't ever been hit, but their partner throws things, and they throw things at the wall right by where they're standing. The implication is that you could be next. It's a very intimidating way to live. So the pattern does not look the same for each relationship. There's not one profile, one set of behaviors that is used by everyone. So this is also a little bit confusing for healthcare providers, law enforcement, courts, clergy. They think that domestic violence is going to look a particular way and that survivors look a particular way or abusers look a particular way. It's our experience that domestic violence does not discriminate, crosses all socioeconomic groups, educational levels, religions, professional groups, and ethnic communities. I have already mentioned that assaults can be situational or mutual, but those are not the kinds of families that we're helping at the Domestic Violence Action Center. We are really wanting to provide support, safety planning, legal services, advocacy, support groups, and intervention to those people who are under the unyielding influence of the coercion and the control by their partner. We're open to any questions that you have about this definition later on when we're together. One of the things that is the most challenging for us at the Domestic Violence Action Center is the abundance and absorption and the ways our community clings to myths and misconceptions. Yesterday, Lydia and I participated in a site visit from a federal evaluator, and she asked us, what are some of the biggest challenges that you face? For me, the fact that we have myths and misconceptions interferes with the community's ability, commitment, and investment in developing appropriate responses. When a community believes that domestic violence occurs only in certain types of families, low-income families, undereducated families, unemployed families, families with a substance abuse or alcohol addiction, the fact that domestic violence happens to brown families in Palolo, that is simply not our experience at the Domestic Violence Action Center. The way we explain the prevalence in data and the stereotypes actually is it's likely that low-income victims and abusers are overrepresented in resourcing, accessing resources because their options are much more reduced, much slimmer than a person with resources, person with access to their own private attorney or a hotel room. So the lack of other resources may explain why it continues to look like domestic violence only occurs in certain kind of families. But again, if we are going to try to address the problem of domestic violence, we have to be candid and brave in recognizing that this problem impacts all of our neighborhoods and all of our communities. It's also widely believed that domestic violence is a loss of control. Just had a bad day or recently lost their mother or their boss is a pain in the butt. Domestic violence is not a loss of control. In fact, quite the opposite. Domestic violence is use of control over the other person, as I said in our working definition. When a person chooses to use a certain tactic to control their partner, they're doing that intentionally, and they're doing that to maintain power over their partner. Again, these are very subtle things that would be difficult for the unaware observer to notice, which is why we like to name it. That's another part of our work, is really naming what we see so that you can see it or look for it or recognize it when you see it. Oftentimes in court cases, when crimes have been committed and it gets as far as the court system, the defense often offers the explanation, well, he just lost control. She was in bed with another man when he got home and he just lost control. He couldn't help himself. That's clearly not the case. It was a decisive act by him to use violence in order to deliver a very, very strong message to his partner. The other misconception is that stress causes battering. And of course, we've heard this a lot this year, that people are under extraordinary stress. And that has contributed to the increase in domestic violence. We all experience stress, and we do not necessarily resort to abuse or controlling our partners or our children as a way of managing our stress. All of us have had to develop coping mechanisms, ways to contain or resolve our stress for our own health and for the well-being of those people who are in our lives. So we really have to disabuse ourselves and the community from a belief that stress causes battering. My husband didn't turn into an abuser during the pandemic. Again, the pandemic did not cause domestic violence, nor did it exacerbate domestic violence in families where it never existed before. And I think that's a very important distinction, because that is used often where we're going out into the community as an explanation for why domestic violence appears to be on the rise. At the Domestic Violence Action Center, our data demonstrates that during the months where we were shut behind closed doors, there were fewer efforts by people to reach out. It was much, much more difficult for a person to make a telephone call, to have contact with anybody. Some of the tactics that were used by abusers included limiting access to the internet or access to other forms of communication. The economic abuse was pretty significant during the pandemic. Obviously, a lot of people were out of work, lost their jobs, were uncertain about their employment. I want to thank Kaylee for adapting this power and control wheel so we could help the community understand what domestic violence looked like. I would encourage you to take a screenshot of this power and control wheel and have it handy so that when you have the opportunity to talk to patients for the first time or clients after when you begin seeing them again, you can explore some of these things to see if they experienced it while they were living without access to respite, employment, contact, or mobility. I was starting to say that at the Domestic Violence Action Center, our data is showing that the fact that people are now able to leave home or not be in the presence of their partner 24 hours a day, 7 days a week, they're more likely to chat with us. We added a chat feature to our website and a text feature to our communication systems, knowing that it would be very, very difficult for people to make a telephone call while somebody is standing beside them. Our calls to our helpline are averaging about 22 a day now. Pre-coronavirus, calls were averaging between 8 and 10 a day. We're seeing many, many more efforts for people to get information, obtain restraining orders, consider their options, and escape from what they've been living with the last year, 15 months. Aloha, yeah. So here's just a sample of comparison between April 2020 and April 2021 to show you that April 2020, when we were really all at home, and April 2021, when people are beginning to venture out, that the number of safety plans, for example, that our staff did in all of our programs increased from 544 to 848. Over the course of this entire year, our staff assisted survivors with about 10,000 safety plans since April 1, 2020 to June, whatever the last week was, June, I don't know, 18th or 17th, whatever day Friday was. Our client contacts are also very, very high. We knew that people were going to be prisoners at home and in great danger. And so we asked our staff to make more frequent contact with clients. And over the last year, our staff have made about 45,000 contacts with the survivors who've been lucky enough to find us. There are about 24,000 children on our caseload. And I think we are anticipating a steady incline, a steady increase as the months pass, because more and more people are going to fear the future and are going to need help navigating their pathway to safety. One of the things we strongly believe is that it's going to take all of us. The problem of domestic violence is much, much bigger than we are at the Domestic Violence Action Center. And we're committed to creating greater collaborations, better partnerships, and working with our community allies, because there's a role that everybody can play. Every sector has a role, whether it's business, healthcare, clergy, legal community, law enforcement. People bring their domestic violence with them to work and to school. And so if you are out in the community, you are likely encountering somebody. If you need help helping them, everybody, please don't feel like you have to be the expert. You can call us, we'll help you.
Thank you so much, Auntie Nancy. I read this quote in an interview that you did, and it quotes you as, "People will shake their finger at me and say, you need to do this one thing. But that's the problem. It can't be solved with just one thing. It's complex, it's everywhere, and it takes all of us." And by all of us, it also means starting younger, going upstream. We're next going to transition to Kaylee. I am going to also launch our second poll while Kaylee gets set up and we launch his PowerPoint. You should see it coming up on your screen now. Can vote at any time. Kaylee, thank you so much for being here. I'm going to turn the webinar over to you. You can unmute yourself now.
Mahalo nui loa for having me today. My name is Kaylee Beyer. I am a part of the Domestic Violence Action Center since 2005, and I've been working primarily with the Teen Alert program, also known as TAP 808. Here I am over at Ka'u High School and Intermediate, where our program has presented, and it's just one of the many places that we present throughout the state. A little back history to the program. TAP 808 started in about the year 1999, where we recognized that teens were not receiving as many services and representation for help and support when it came to their dating relationships. And so the Teen Alert program was created primarily to focus support for the young people in our state. And it started at McKinley High School as kind of like a room people could come to come get help. That probably said something like dating violence, so you can imagine not many teens were willing and looking to just walk into a closet to get support. But from there, it expanded greatly over the years. We've pretty much reached every school throughout the state, public and private. We have the education component, we have the advocacy component, we have a strong online presence, which is a main way teens communicate in this day and age. And we really want to focus our presentations and our advocacy on reaching those younger people and making sure that they're able to be empowered to have healthier relationships. So a lot of our program will be focusing on what healthy relationships look like and how they can get the support and offer support to each other. We are also an inclusive program. We recognize, like Nancy had said, abuse can happen in any relationship, any demographic goes through this. And as that poll showed us, a high percentage of the teens in our state actually are experiencing their own type of abuse, and oftentimes underreported because maybe they feel that others won't believe them, others might judge them. Maybe if they are or do identify as an LGBTQ plus person, they don't want to out themselves to their parents, to their friends, to other resources. And so we want to make sure that as a program, we focus our services on anyone that might be needing them. And like I had mentioned, we're really trying to empower the youth to have a voice, to have healthier relationships. And our slogan is to tap out dating violence, kind of a play on words with our Teen Alert program, but to really recognize what is abuse, what are unhealthy traits, and work to end those for their relationships and other people's relationships. So as I had mentioned, we do offer advocacy services, which are free and confidential for folks ages 12 to 21. And unfortunately, we do see abuse can happen for younger relationships. And maybe this is the first time they're navigating a dating situation. And so they don't always have the tools or knowledge to, recognize what is unhealthy, what kind of things could turn unsafe and potentially lethal in some situations. So we want to make sure that we can help them identify from a young age what traits to look out for, even for their friends as well, so that they could be a support service for them. And so in regards to our advocacy, just like adult clients, we do a lot of safety planning with our teens. We provide community resources because, in some situations, these are folks not located on the island of Oahu, and maybe they need access to other community resources. We can also accompany teens to court, which is, a lot of times where we find those clients. Maybe their parents are trying to get a restraining order for them. And, that's when we initially make that contact with the teen. And then we can do ongoing DV education and counseling, because a lot of the times the teens experience the fear and the pain and the trauma, which doesn't just go away once that relationship is over. And these are such important things for the teens to have access to. Our presentations is oftentimes where we introduce the teens to these healthier concepts, talk about the power and control wheel, talk about what to look for and how best to be an upstander to other friends. And during the COVID-19 pandemic, because schools were put on lockdown, our in-class presentations were kind of put on hold, and we had turned virtual. But here's an example of us at King Kekalike. Back in the day, we used to use a lot of skits as a way for the student to kind of put themselves into the shoes of a survivor of abuse, even sometimes the perpetrator, to kind of recognize those unhealthy traits. And, just really finding ways to be interactive, which, having turned virtual, can be kind of tricky to, figure out how to navigate a virtual realm and keep the students engaged. And so, as you've been seeing in today's webinar, having polls is one of those ways to keep the interaction alive. We do a lot of breakout rooms, we share a lot of videos. We've done things like Mentimeter and Kahoot, which is, kind of more interactive quizzes. Back in the day, in those in-person presentations, we like to use Jeopardy as a way to kind of keep the kids engaged. Just really anything that can get them thinking about the issue, and sometimes offering that kind of gentle competition can keep the presentations really fun and keep them thinking about what to look for. Our program also offers after-school presentations. So we've been doing the Opio Empowerment the past 2 semesters, where teens have volunteered to join us every week for a 10-week session. We focus a lot of our curriculum on Olelo No'eau and historical Hawaiian perspectives on health and wellness. And so getting the youth involved to do writings, talk story, have breakout sessions, and also inviting teens to volunteer to kind of help coordinate these sessions. There's also the My Story program, which has basically been female centered. So unfortunately, I can't speak to that from my own personal experience, having not been involved with them, but that is also another way that teens are engaged in a lot of ideas of what does self-care look like? How do you practice resilience? Because if we can't be healthy for ourselves, how are we going to be healthy for other people as well? And so these groups are really important ways for the teens to continue that conversation beyond just the in-class presentation, and really kind of recognize their own worth and how they can empower themselves to help others. In the past, we've also collaborated a lot with other community groups. I was fortunate enough to run an art group at the Youth Outreach Center in Waikiki, which is a drop-in center for houseless youth or street youth. And those are pretty much weekly or bi-weekly for about 15 years before the pandemic hit. And we were pretty much put on lockdown. And also in the past, TAP has involved with the community. We had a youth summit in 2014 and other events that just bring those youth together to kind of keep that conversation going. It's really important that the youth can be leaders in this issue and, allow us to kind of take a step back and let the youth do some of that talking and presenting and just really engaging with each other. Because I think a lot of times youth can hear each other differently than they might hear some adults. We have also done single gender groups, and I really like this quote here because it kind of highlights the importance of reaching young men. We see that disproportionately it is men causing abuse against women. Not only men abuse women, but if we can reach younger men at a younger age and try to dispel some of those gender role myths and stereotypes that allow men to perpetrate violence against women and children, then we can move men in a direction where they can be nurturing and use their strength to provide support and not hurt other people. And it's really valuable, I think, for our community to have strong Kane that help each other out and see that there is a value in supporting an equality between men and women. We've also done service provider trainings. I think this might be animated. There could be a picture in this. And I just wanted to highlight the fact that, sometimes talking to adults that work primarily with youth is really important. Kind of like Nancy had mentioned, there are a lot of myths around who's the abuser, what does abuse look like, how to provide support. And when working with teens, we really need to be trauma informed and kind of recognize, some of the challenges they face in reporting their situation, reaching out for support, and even recognizing what is abuse. So if you are, someone that might be interested in service provider trainings, we also can do those too. We have a lot of training materials, such as our Youth Advisory Committee training manual, which we've provided to schools around the state. We have a teen-centered power and control wheel, designed to recognize some of the different examples of power and control for teen-specific relationships. We also have a teen alert program manual, trifold brochure, as well as a workbook, which is chock full of information and different interactive activities. With the pandemic having hit last year, we haven't been able to pass these out as much, but looking forward to the future when we can continue to promote these services and materials in the schools. We have online resources, as I had mentioned, so tap808.org is our website. If any folks would like to check that out as a resource for teens in their lives or just for valuable information or to make connections with our program. We have put together these different toolkits for Teen Dating Violence Awareness Month in February. We also have a blog section with art and comics. This is a comic I put together. So, if we have any fans of comics out there that is centered around the issue of teen dating violence, that's another resource. We also seek out youth submissions, which is a really great way for the youth to kind of continue to think about the issue, promote their own perspective on it. And this art piece was created by a youth here on the Big Island from the Hawaii Arts and Science Academy in Puunua. And, she did a whole presentation about teen dating violence after having seen our presentation. So really great way for youth to continue the conversation. And then we have created a volunteer group that we're running for 7 weeks this summer. And you know, somehow the kids find out about it and are encouraged to join us. I'm always surprised when teens want to take time out of their week to talk story with a bunch of adults about an issue that's important to them, but I'm always really stoked because, you know, the teens have a lot of energy and can reach more people than we possibly can. We also have swag. So you know, this is some of our upcoming swag that we'll be printing, which is another great way to entice the teens to kind of continue thinking about us as a program, know that we're a resource in the community. And this No Rush Love Bra is a sticker that we put out, kind of, you know, just capturing that youthful element. And they're always excited when they get free stuff. Who doesn't like free stuff? And lastly, we have a large online social media presence. Obviously, there is no MySpace anymore, but I just wanted to highlight that historically we did have one. That was kind of the start of our social media. From there, we went to Facebook. If you'd like to join us at any of these places, at Teen Alert Program, as well as at the Domestic Violence Action Center to follow our social media content for DVAC as well. We have an Instagram page, a Pinterest, which has a lot of different content. If you wanted to use any of these images, please feel free. We've created a TikTok, which a lot of the volunteers are excited to create content for. We also have a Canva and then a YouTube page. So, you know, a lot of ways for us to reach the youth. And, you know, if you want to help spread the message, please feel free to check any of those out. And that concludes my portion.
Thank you so much, Kaylee E. We inserted into the chat the ways in which you can follow TAP 808 and DVAC on social media and connect to their resources on their website. I follow all of their social media accounts, and they share a lot of tools for awareness. They bring awareness around events that are happening virtually and in person in the community. And last summer, I was able to attend a session with high school girls in our community, and I really walked away with a ton of great tools that TAP 808 facilitated during our session to speak about domestic violence much more effectively with this age group. So I want to welcome Lydia now and Christina. Lydia, I'm going to come to you first. When I first heard about Hale Maluhia and the grand opening, I was like, now that's a contemporary Puunua. And I want folks to know, what is Hale Maluhia and why is it important, and what is some of the work that you folks are doing there?
Well, Hale Maluhia is actually a dream come true for Domestic Violence Action Center. It is a permanent supportive housing program for survivors of domestic violence on Oahu to address the needs of the survivors and their families who have become houseless as a result of the abuse. So survivors are provided with housing and support services such as advocacy, legal representation, groups, career development. And if I speak about career development, we have had residents here who are in. We connected them with YWCA on their RISE program, wherein it's an 8 session. They are trained into resume writing, application, then they are given dress for interview. They connect them with part-time jobs. And one of the residents had done a part-time job through that program. And we continue to gear towards financial literacy program later on and skills development. With stable housing and support services on site tailored to the needs of the survivors, then they can move forward towards self-stability and empowerment. Now, why is it Hale Maluhia, or housing for that matter, is important for survivors of domestic violence? Domestic violence intersects with houselessness. So a victim may flee the home because of abuse, then she'll end up a part of the houseless population of the island. So where will she go? It's either she goes from couch to couch, or to a friend, or to a family who is supportive, or to transitional housing. Or if she has a car, then they live in the car. Or if she has none of those that I've mentioned, then she lives on the street, which is like 90% of our survivors need housing. That's why Nancy really worked hard to be able to find housing, permanent housing as Halimalihuia. And Divac was able to ink out a contract wherein Divac will provide support services on site. So I manage that Divac advocacy program here, and I have one staff. The landlord tenant property management is through the Housing Solutions Inc. It's a nonprofit management property that will deal with rent, maintenance of the property, and things like that.
Lydia, I know when Halimalihuia started that the program was funded through the Ohana Zones for the state's homelessness initiative. Can you tell us the ways in which you folks are collaborating and you're using this as a platform to bring larger awareness to how the systems and community can work together?
I think I have to ask Nancy to answer that question, because she's really the core of how we are trying to attract donations or grantors to replicate what we have here at Hale.
We watched the community discussion about houselessness for 10 or 12 years, recognizing that no one was talking about the population of survivors who had fled or escaped as constituents in the houseless population. The community, our elected leaders, foundations, administration talks about houselessness as a serious problem, but never talked about how it impacts families who are suffering the harm of abuse. When the safe house, this used to be the property that Lydia is referring to and describing, was formerly the prosecutor's safe house run by the Department of the Prosecuting Attorney. It was pretty gravely underutilized and ineffective. And Divac did some pretty effective, apparently, advocacy with our city council and with the city administration to explain the relationship between domestic violence and houselessness. And we were able to secure their commitment to sustain the property as a apartment building reserved for survivors and their children. So with the governor's office, the Ohana Zones support, and the city and county, the Department of Land Management, Department of Community Services, and did I say the city council? They made a commitment and recognized that there is a considerable relationship between houselessness and domestic violence. And we continue to advocate for replication of the model. In our estimation, it's really not a good fit for a person who has been living with trauma to go to a general population of houseless people. And so we want to have places where survivors and their children can be free and safe and build community amongst themselves because of their shared experience.
Thank you so much for explaining that. I want to bring in Christina now, because I feel like maybe some of this work is very linked. And I wanted to also talk about the ways in which Divac is creating and structuring programs specific to the cultures and the people here that live in Hawaii. Christina, welcome into the conversation after 30 years in Divac's success. Tell us about the cultural programs for the community that you folks offer.
Sure, it's our pleasure. Thank you for asking, and thank you for inviting us. They say that do what you love, choose the job you love, and you will never have to work a day in your life. I've been with Divac for 18 years, and every day I come to work feeling new and energized. I've done direct service for many, many years before I transitioned to administration and program management. I did direct service here at Divac, working with many of our immigrant population for about 7 to 8 years. Our work at DVAC is very, very unique. It's adaptive work, it's fluid, and it's intentional. Very, very close, if not really, the intention is to to work very, very closely to what our mission is. As you are very aware, our population in Hawaii is quite diverse, and that we have different ethnic groups, and our DVAC clients reflect the Hawaii multicultural population too. For instance, just to give you a little glimpse about our fiscal year 2020, we did service 30% Native Hawaiians. We serviced 19% Caucasians, 3% African Americans, 2% Hispanic, and the remaining 46% are Asian Americans and Pacific Islanders, of which 24% are Filipinos, 10% are Japanese, 10% are Japanese nationals, in fact, 7% are COFA nations, including Republic of Palau and our Marshall Islands. And as we know, each community brings their own understanding, their own values, and their own belief system. And with that, their attitudes and perceptions of domestic violence also vary. Our survivors may share the same experiences of their abuse, but we know that their perception and their interpretation of what happened to them vary because of their embedded cultural belief system. We also know that 20% of the people who are in Hawaii speak another language other than English. So like what we have said, our clientele at DVAC, and it has been consistent in fiscal year 2019, we have serviced 40% Asian Americans. This last fiscal year, it was 46 AAPI. So it's quite important for DVAC to approach our work in a manner that would be effective and would impact and will produce good outcomes as far as the population that we service. One approach that we have done and are continuing to do is hiring of bilingual and bicultural advocates. We do believe that, and it is a known fact and best practice as well, that if you are, for instance, in a foreign land and do not speak the language or do not understand the culture, you're not familiar with the US system, and you're isolated as a result of DV. It would be very helpful for her to see someone who speaks her language, to see someone who may look like her and understands the culture. Hence, our hiring of bilingual and bicultural advocates is intentional for that reason. Nancy, we missed to describe how our agency has started, but there are now 48 people in our agency, and there are 12 different languages spoken within the agency, of which 10 of those 12 languages are our staff who are providing direct service to our population. We do have advocates who speak Visayan, Tagalog, Ilocano, Spanish, Portuguese, Mandarin, Tongan, Marshallese. I'm not sure. We just hired the Hawaiian one. I'm not sure if she's conversational or fluent in Hawaiian, and Japanese and Korean. We are very mindful of our survivors' journey. It's very different, and we are committing to meeting them where they're at, which means to say that we just don't service who are survivors who have left the relationships. We are working with women and men who are planning to leave their relationships or want to stay in their relationships but want to be safe. So it doesn't matter where you're at in your phase or in your life. If you have experienced harm from an intimate partner relationship, then we're here to help, and we're hoping that our cultural cultural and linguistic programs are equipped enough to help the population that we're seeing here. We recognize that trauma is any event that they may have experienced at childhood. Oftentimes, we may hear from our survivors that they have been in a relationship only for a year, and that a year could mean a lifetime for someone, but then not recognizing that there are other trauma that she has experienced when she was a child, and she was a child abuse. She witnessed she was sexually assaulted and whatnot. Therefore, she brings with us extreme trauma, and we ensure that our emphasis on her healing is also adequate by providing our staff, the appropriate training, and if not, providing her the resources so that it can impact her whole well-being. We are very, very much attuned to the needs of our survivors, meaning to say that we are constantly in communication with them and trying to ask them what we think or what they feel we must change or need to adapt in order for our services to be effective, because we believe that there's no one size that fits all. One good example of that is our support groups, for instance. We recognize that the Western approach of receiving mental and therapeutic services are not quite mirroring the needs of many of our survivors, especially from our immigrant communities. Hence, we have adapted the way on how we can speak to their needs, and they tell us what would work for them. We have developed a curriculum and modified some of it so that it would be meeting each cultural components of what they think would be healing for them. It was also intentional that the facilitators or the people that are providing services in our support groups would be speaking the same language. We have had many support groups that's culturally based and linguistically based. We've had Korean groups, we have Japanese groups, we have Tagalog speaking groups, we have Hawaiian groups, we have an LGBTQ groups. We recently just completed our COFA groups. And of course, we do have our mixed groups as well. And we also have our military groups, because people who are in the military who may not have been or may not initially have been here in Hawaii have come from many different states. They have the commonality being military dependence, for instance. And we want to make sure that when they meet with other support members, then they would be speaking their own language and they would have their own understanding of what that means to be a military dependent, right? So the approach is quite holistic in nature. At DVAC, from the get-go, we have recognized, it started as a legal helpline back in the 1990s, of which there were two attorneys who would volunteer their time during their lunch hours to provide legal consultation over the phone to people who would need our help. But then it was recognized early on by Nancy that, and the other founders, that oftentimes it's not just legal that they need advocacy work. And in fact, oftentimes they couldn't proceed with the legal work of wanting to divorce because they don't know how to achieve the other social services that they need. Hence, advocacy was created. And we do now have an outreach program over at Family Court, wherein we provide services to petitioners who we have assessed to be victims of intimate partner violence. We work with them towards their safety planning or providing them the resources in the community. Accompaniment to court is a big thing that many of our survivors are very, very much grateful in having while they're in the process of obtaining legal relief in order to remain safe.
Thank you so much, Christina. I'm gonna jump in so we can transition to just one as we wrap up. I just wanted to ask, you know, for all of you to share one hope you have with everyone. What's one hope that you have for everyone to take away with them today, in thinking about safe communities being at the core of healthy communities and healthy families? And we can just open it up as we start to transition and wrap up. And I will also, I'll also be launching our final poll. Maybe, maybe Lydia, will come back to you. One hope that you have for everyone to think about safe communities and healthy communities together.
Let's all be part in making our island safe and letting them know that we exist. Help at Divac exists. Give our numbers and we will talk to them. We are not really the savior, but at least we will be able to guide them as to when they want to leave, or if they don't want to leave, we'll always be there for them.
Great. And Kaylee, one hope you want us to walk away with on community safety, healthy families, healthy individuals.
I would just say that if we can recognize that, you know, young people grow up into adults, and the more we can equip them with, you know, healthy options, safety and security, the better equipped they'll be to have those things with their family and future relationships as well.
And Christina, what one hope you have for us to walk away and reflect on today?
We can understand, I'm hoping that we can understand a little bit about basic information on domestic violence, and that we want to stay away from the usual question of many of why does she stay, and instead, you know, have a conversation and be open about it and be comfortable about it. Actually, the bigger question is why does he hit her, right?
Mm. And Auntie Nancy, one hope you have for us to consider as we go into the second half of the year, as we transition into COVID recovery?
I think my, or at least one hope of many, is that we remain inspired in our service and live as allies to our community, and that our community will rely on us to help them help the community.
I'm going to provide your folks' contact information here on the screen. I hope everybody can see the information about the lines and the internet resources. If somebody from the DVAC team is able to just touch on this really quick, I think this is critical that we provide these resources to everyone listening in live. They've also been put into the chat. And because this is recorded, we also want to make sure that anybody tuning into this later can also access you through multiple pathways.
The Domestic Violence Action Center secure online chat is at our website, www.domesticviolenceactioncenter.org. Our text line, 605-956-5680. People can text us from their phone. And our legal helpline number is 531-3771. We provide toll-free Neighbor Island resource support, which of course people really don't need anymore, but the toll-free number is 800-690-6200. If you go to our website and travel around a little bit, you'll be able to see all the resources that our community has. There are other agencies that have domestic violence programs. The Domestic Violence Action Center is the only standalone agency, but Child and Family Service has domestic violence programs. Parents and Children Together has domestic violence programs. Catholic Charities Hawaii provides support to those suffering the harm of abuse and to perpetrators as well.
Thank you so much. That information is vital. It's critical. We also know that you're on the Unite Us platform for Hawaii referrals now that we're working on as well at AlohaCare. So I believe our care coordination team can already start finding more information about your services right there within Unite Us. As we wrap up today's webinar, I just really want to mahalo Christina, Kaylee, Lydia, Nancy of the Domestic Violence Action Center for your folks' time, expertise, and sharing. We also, want to just thank everyone for joining us today. For anyone joining us who is surviving something, we hope that we were able to provide you resources that you might be able to look further into. And we also hope that we were able to be a virtual little pu'uhonua and safe space for your learning and education as we continue to make Hawaii healthier and make our communities safer. I want to thank AlohaCare's leadership team for prioritizing the needs of the members we serve who are surviving abuse and trauma. I also want to thank everyone who joined us for this 6-part training series to enliven a culture of health across our organization. It's been an honor to moderate these virtual discussions during the pandemic with courageous, compassionate, and creative leaders, just like the 4 of you who are truly leading the way in Hawaii. I know many of us agree that a culture of health is healing and that our beloved communities thriving for all people is the light of justice that we need in 2021. I especially want to thank Clayton, Chelsea, and Mindy for helping all of these episodes become a success. More than 1,000 participants have watched us over these 6 episodes, which will remain as a public educational health resource on AlohaCare's YouTube page. Thank you for building safe, healthy virtual community with me. I'm Kealoha Fox for AlohaCare, and I just wanted to say aloha mai kako, mahalo nui oko. Thank you so much, Domestic Violence Action Center team. We're so thankful for you, and we're so reassured to know that you're there and you're experts providing these services and advocacy in our community. Thanks for starting your morning with us. Aloha.